is Ava Harrell, and I am the Community Engagement Fellow at the Center for Community Engaged Learning. Maddie and Laurel, do you want to go ahead and introduce yourself?
Hi everyone, I'm Maddie, she, her, hers. I'm the Communications and Outreach Coordinator at the Center for Community Engaged Learning, and we are just part of the team that helps put together these events. So I'll pass it on to Laurel.
Hi everyone, Laurel Hurt, I'm the director of the Center for Community Engaged Learning, she, her pronouns, and yes, happy to be here tonight and hosting Erin.
On behalf of our office, the Gender and Sexuality Center for Queer and Trans Life at the U, and the Women's Center, we are pleased to welcome you to a community conversation with gender justice, focusing on advocacy. But before we begin, I would like to start by acknowledging and recognizing the pain and sorrow and grief and anger being felt in our communities, and let you know that we stand with you as we process and mourn the death of Amir Locke, yet another Black man killed at the hands of the Minneapolis Police Department. The department has repeatedly shown a disregard for Black and Brown lives in our community, and this cannot be allowed to continue. Justice for Amir Locke means dismantling the systems that killed him. For more resources and for information about how to get involved, we direct you to our longstanding community partner, Communities United Against Police Brutality, and to Take Action Minnesota. And then this event is part of our Ways to Social Change series, which came out of the inability for students to participate in direct service during the pandemic, but has grown to be a way to encourage students to participate in many different forms of community engagement to work towards social change. Tonight's focus, advocacy, combines many different aspects of social change, including raising awareness, community organizing, and formal political activity. And tonight we are lucky to have the Advocacy Director of Gender Justice, Erin McQuaid. Erin works to advance gender justice's goals through public education, legislative outreach, strategic partnerships, and coalition building. In addition, she was elected to the Minnesota House of Representatives in 2016 and is running for the Minnesota State Senate. We'd like to thank Erin for her willingness to speak to us tonight about the mission of gender justice, the cases that they're working on, and how she recommends that students and the general public get involved in advocacy work to advance gender justice's goals. We're going to start with a presentation from Erin, and then we'll move into Q&A. We'll be using some of the questions that you submitted on your registration forms, but feel free to continue putting questions in the chat as we go. And I'll turn it over to Erin. Thank you so much.
Well, thank you so much for having me. Good evening, everybody. My name is Erin McQuaid. I use she, her pronouns. I am the Advocacy Director at Gender Justice, and I'm heavily pregnant, and so I'm hungry and eating and drinking all the time. It's like 90% of what I do. So I'll be pausing throughout to take sips of water, like eat stuff my wife just puts next to me. It like appears as if from nowhere. It's wonderful. So I have a presentation that if I can share my screen, I'll get started on. And I'm going to talk about gender justice more than I'm going to talk about myself, but you can ask questions about me as well, and feel free to put questions in the chat as well. So I'm going to talk a little bit about the nonprofit sector actually first. I remember I was 25 before someone really like broke down the way that kind of our sectors of work exist, and it was really helpful for me. So there are three sectors really in America. We have private sector, which is business and industry. We have the public sector, which is government and public educational systems. And then we have the nonprofit sector, so charitable organizations, membership associations, and professional societies. Gender Justice is a nonprofit. There are a bunch of different kinds of nonprofits. So you have 501c3. These are tax codes, by the way. So Special Olympics, YMCA, the Met. You have professional trade associations. These are 501c6s, so the American Dental Association or AARP. You have 501c4s, and these are national social welfare organizations. They also tend to be more political, so the NAACP, National Organization for Women, Sierra Club. And then you have social organizations, 501c7, swimming clubs and gardening clubs and alumni associations. Gender Justice is both a 501c3 and a 501c4. The 501c4 is new. So on our 501c3 side, that's the side that I work on. That's all pretty much everything that's not political, like electioneering, we call it. So anything that is involved in talking to candidates, electing candidates, talking to voters about specific candidates, that all falls into the 501c4 category. And it's brand new for our organization. So we really haven't done any work in a 501c4 space yet, but we can. We just haven't yet. There are about 1.5 million nonprofit organizations in the US. A lot of them are in Minnesota. We have a high rate of participation both in volunteerism and charitable giving, and nonprofits are a huge part of the economy here in Minnesota. Assets totaled 2.4 trillion. They're about 10% of all private sector employment, employing about 12 million people, although I haven't run the numbers since the Great Resignation started. And approximately, I think it's closer to 70 million Americans volunteer their time with nonprofits, and individual giving, foundations, and business giving is in the almost 500 billion now. So about gender justice, our mission statement is we are a legal and policy advocacy nonprofit dedicated to advancing gender equity through the law. And our vision, which is different from our mission, is we envision a world where all people can thrive regardless of their gender expression, and sexual orientation. This involves dismantling legal, structural, and cultural barriers that contribute to gender-based oppression and ensure people of all genders a right to bodily autonomy, safety, health, and opportunity. So our mission is what we do, our vision is what we want in the world. And here is how we achieve our vision and mission. We use legal analysis, impact, and strategic litigation. And I want to be really clear about the difference between impact litigation and maybe the litigation you're thinking of. So impact litigation and strategic litigation means that we have plaintiffs or people that we represent in court, where when we win, we change the law. We win for our client, yes, but there's a win that's for a much broader community. We change how the law is interpreted or applied or enforced for a whole group of folks. We do not work in the criminal legal system. We work in the civil system. We do not believe that solutions to the problems that plague us live in the carceral or criminal legal system. So we don't sue people to try to send them to jail. We do policy advocacy. So we help develop policy. We give testimony and comment on policy where it's successful, where it's failing, where it needs to be clarified. And we also work against policy, which we can talk about, I'm sure. We do narrative change in public education. Our understanding of gender, so a lot of gender-based groups are either what you would consider like traditional women's organizations or maybe traditional LGBTQIA+ organizations. We understand gender to be a both and so we do trans and LGBT work. We do what you consider like gender-based violence or quote unquote women's issues, although we don't use gendered language, gender justice. And so part of that work, because we're often on the forefront of destroying the gender binary or getting it removed from how we think about the law, involves narrative change in public education. Judges are people too. Jurors are people too. And so when we want to win in court, sometimes that involves winning outside of court in the court of public opinion. And then we know that the law alone is not enough. We know that the best we can hope for in the legal system is harm reduction. It is not the solution. And so we're not looking for liberation through policy. We're not looking through liberation through lawsuits, but we are looking at harm reduction. But we do our work in partnership and in coalition with a lot of organizations who are working on the broader movement for social justice, because ours is just but a piece. A little of our history. So these are the two people on the right are our two founders, Jill Galding and Lisa Stratton, and then our very first board chair, Deb Fitzpatrick. Lisa Stratton and Jill Galding were plaintiffs' attorneys who essentially weren't able to do the kinds of cases at their big law firms that they wanted to do. So they broke off, and I think they like cashed in their 401ks to live off of for several years to like win their first case. They are incredible people. They're no longer with the organization. They do lawyering in other places, but they're wonderful founders. And in 2012, they helped found and join the Alliance. At Gender Justice, we just call it the Alliance. We don't use the rest of the term. We are partnered with more traditional women's organizations, why you see women there, state advocates for women's rights and gender equality. In 2012, we successfully settled the Zuniga case, which was one of our first cases, and were instrumental in passing the Women's Economic Security Act, or WESA, through the Minnesota State Legislature. 2015, this is one of our big groundbreaking cases. They teach this case at like Harvard Law School. We had the Rumble case, which established that trans folks are covered by Section 1557 of the ACA. Section 1557 of the ACA, the Affordable Care Act, says that it brings in a bunch of different places in law where there's anti-discrimination. So the Civil Rights Act and the ADA and all of these things, and it says you can't discriminate in healthcare on the basis of da 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 da. And we sued to clarify that discrimination on the basis of gender included discrimination against trans people. And so our case clarified that the Affordable Care Act protects trans people from discrimination in healthcare. In 2016, Megan Peterson, our executive director, was hired, and we launched in 2017 a coalition called Minnesotans for Trust, Respect, Access. And it was a proactive reproductive rights campaign, and it was a fiscal sponsor to the Minnesota Women's March buses to DC. In 2018, we got significant grant funding to expand our reproductive rights and justice work. And that included hiring me on as the advocacy director. And we won our first jury trial in Florek, which was a civil sexual assault case of a woman who was sexually assaulted by her partner. She was actually undergoing chemo treatment and was taking a lot of medications. And so she was in a relationship with this person and had taken like sleep medication, and he assaulted her while she was sleeping. And we won that trial in the civil court and clarified that sexual assault, of course, can happen between people who are in relationships too, as it often does. In 2019, we filed really big cases, 2 cases protecting trans students. One is NH v. Anoka Hennepin. We won that case, which I'll talk about in a minute. We filed Doe v. Minnesota. We are suing the state of Minnesota to remove the abortion restrictions from law. And then Anderson v. Thrifty White. Anderson v. Thrifty White, Andrea Anderson is a mom of 5. She lives in rural Minnesota, and her partner had sex. Their primary form of birth control failed. And when she went to go get emergency contraception from the pharmacist, he denied her because of his religious beliefs, which is illegal and unconstitutional. That's gender discrimination. So we're suing the pharmacies who denied her medication. And then we launched the Unrestrict Minnesota campaign and hired Jess Braverman as our legal director. In 2020, we survived COVID. We're pretty excited about that. We had to cancel our 10th anniversary event, and a lot of our time in 2020 was dedicated to helping either mutual aid or organizing in response to the murder of George Floyd and the uprising. And so in 2021, we had our major win for trans students. In 2021, that case that we filed in 2019, we won and got the Minnesota courts to say that in the state of Minnesota, it is unconstitutional. It is discrimination against students to prevent them from using the bathroom that aligns with their gender identity or play sports on the teams that align with their gender identity. So a lot of the anti-trans youth in sports bills that are sweeping across the country asked, answered, and settled here in the state of Minnesota because of 2 of our cases. We also filed a case called Cooper v. USA Powerlifting. This is one of the first cases of a trans athlete suing a sports organization for discrimination. Our amazing plaintiff, JC Cooper, she's a powerlifter, she's a daughter, and she's a trans woman, and USA Powerlifting blocked her and all trans women from participating, which is discrimination and it's not okay in the state of Minnesota. So we filed a case against them. And then we helped support the creation of the Legislative Reproductive Freedom Caucus in the Minnesota legislature. And we organized rallies as attacks on abortion rights in Texas and at the Supreme Court intensified. So I'm just going to show you a little, so that's a lot. That's a lot of our work shoved into one slide. But I think this kind of demonstrates how we understand gender, right? Gender discrimination, gender bias, it spans the gamut, and it really puts us into these places where we're talking about gender-based violence, where we're talking about denying someone healthcare, where we're talking about emergency contraception and abortion rights, and also right to compete, and gender equity in schools. Like it really, but all of that falls for us under the umbrella of gender. So here are some of our core campaigns, right? Because I talked about doing strategic litigation, but we also do that public education and that narrative change work. So this is one of our core campaigns called Let Them Play. This is our trans inclusion in sports work. This artwork is done by an amazing trans artist that I can pop their Instagram into the chat when I'm done presenting. And we work really closely with both our trans clients and artists to really bring some joy. I mean, that's what sports and athletics is about. It's about finding a team. It's about doing your best. It's about uplifting others. And so we really wanted to showcase, why people get involved in sports and athletics in the first place, and remind folks that like there is room for everybody on a team. We also have Unrestrict Minnesota. I'm so proud of Unrestrict Minnesota. This is just a key part of my work. I'm the campaign manager and coalition director for Unrestrict Minnesota. We are a coalition and campaign working to protect and expand access to abortion care and all reproductive health care in the state of Minnesota. And our vision is to achieve reproductive justice, which is the 4 primary principles being, right? It's a political framework and movement that was created by Black women. The primary principles is the right to have a child, the right to not have a child, the right to raise children you choose to have in safe and sustainable communities, and gender freedom and bodily autonomy. And so our coalition exists alongside that litigation I talked about to remove the abortion laws in support of that, but also to remove the restrictions either through the legislature, through litigation, and then to create the reproductive rights, health, and justice movement that we know we can have in Minnesota. This is a multiracial, multi-sector campaign that centers the work of Black and Indigenous women and femmes, and it centers the experiences of those most impacted. This was our back to school campaign. We called it New Year, New Law. You'll remember we won that case that clarified that it's discrimination and unconstitutional and illegal to segregate and discriminate against trans students in schools. And so we had the New Year, New Law. We tried to make it look like, doodles in a yearbook or stuff you do in your notebook. And the Trans Women Belong in Sports, Lift Up Trans Rights work as well. This is a huge project that Gender Justice undertook with that alliance I was talking about earlier. This is a report called Designed to Deceive, and we studied the crisis pregnancy center industry in 9 states, including in Minnesota. So on the right-hand side of your screen here, you'll see that there are 7 providers of abortion in Minnesota. There's 8 actually now. We have one, a new clinic opened up to provide medication abortion. There are 90 CPCs in the state of Minnesota. These crisis pregnancy centers do not provide healthcare. They do not provide pregnancy care. What they do is they shame and stigmatize people who might be seeking abortion care. They lie to them. They tell them, they're further along in their pregnancy than they are, or less far in their pregnancy than they are. Right now, we're seeing a lot of folks who are choosing to have medication abortion and are going to a CPC because they need to know how far along into their pregnancy they are, and they're getting misdated ultrasounds because the people who work at CPCs are not clinic professionals, and so they're not trained to provide diagnostic ultrasounds. This is a really dire state of access of abortion, and also it really excuse my language, it kind of floods the zone with shit, if I can borrow a phrase from a really horrible person, because often these CPCs are stationed across the street or next door to places that do provide reproductive care, including abortion care. As we're seeing bills like the one in Texas that ban abortion and then places a bounty on people's heads for helping people access abortion care, CPCs are poised to become the surveillance state, essentially, to surveil people and execute these bounties. They are often connected to national and international networks that collect extensive data on people who come through their doors, like medical history and mental health history, name, address. They geocache people. It's really serious. And in the state of Minnesota, they receive $7 million. Crisis pregnancy centers receive $7 million every biennium from the state. So our taxpayer dollars paid for this in the state. Gender justice is also part of what we call the Rights, Faith, and Democracy Collaborative. It's an initiative of the Proteus Fund. And this is a group, we're in a cohort of 4 with Take Action Minnesota, Jewish Community Action, and Outfront Minnesota Gender Justice to really study the ways that white Christian nationalism or white identity Christian nationalism is being used to erode rights and enshrine discrimination into law. And so it's a newer cohort, and we're launching an initiative that has no name yet, and launching a survey because we really want to understand how other people understand this issue. It pops up in so many different places, but oftentimes the way that the social justice movement responds is, over here we're talking about voting rights, and over here we're talking about reproductive rights, and over here we're talking about LGBTQ rights, and over here we're talking about minority faith rights. But the common thread through all of that is white identity Christianity is really, it's the same opponents in all of those places. And so figuring out how we put those together. I'm going to pause there because I have given a lot of information in a really short amount of time, and just ask if there's any questions.
Yeah, if anyone has any questions, feel free to unmute yourself and speak, or go ahead and put them in the chat.
I'll go ahead, Erin. So you mentioned the large number of these groups that are fairly close to reproductive rights organizations. Are there particular entities or names of organizations that constantly reappear in Minnesota?
Sure, that's a good question. So often what will happen is these will appear to be independently owned, small little clinics that popped up with names that are remarkably similar to the real clinic that they're next to. So a good example is in Duluth, before they rebranded, there used to be the Women's Health Clinic, and right across the street is a crisis pregnancy center called the Women's Health Care Clinic. So you've scheduled an abortion at the Women's Health Clinic, and you show up and you're looking at 2 buildings. And then there's also outside of your clinic are anti-abortion harassers who are like, no, you're over there, you're over there, you're over there, right? So they divert you over there. Mm-hmm. But usually they're connected to organizations like Heartbeat International is one. I can drop the report into the chat too. It's, they're usually connected to a national or an international group, and they use the same website templates and language, but they all appear to be different. And they also use a lot of what I call blackwashing, where they will use the images of Black and brown people to lend itself to an inclusive or legitimate air too. So really nefarious stuff. And I should say that not every crisis pregnancy center does this. Most do. There are some that provide legitimate services to pregnant people, but they're banned. There's a gag rule on talking about abortion, which inherently endangers a pregnant person when they don't have access to the full spectrum of pregnancy care. But there are some that provide, STI testing or birth control or stuff like that. But a lot of them do not do that. I see in the chat. I worked for Planned Parenthood and was trained to tell people that the fake women's health clinics could provide help with childcare things if people needed it, but just make sure that they're aware it's biased. However, now that I'm hearing about the data collection, what do you recommend instead? That's a great question. So it is true that a lot of people who visit crisis pregnancy centers know that they're going to an anti-abortion clinic and are going for things like onesies and diapers or car seats. The problem is that none of this stuff is free. I mean, it is free as in money is not exchanged, but it is often comes as an earn as you learn, where there are faith-based counseling sessions, abstinence-based counseling sessions. So, someone goes in and they say, I don't want to get pregnant again. If I'm pregnant now, I don't want to be pregnant later. They won't counsel them to, you know, get an IUD or use LARCs, long-acting reversible contraception, or use condoms even. They'll just say no, abstinence is the way to go. So what we really need, what we know exists, is an actual need for real services to community. Places where people can access childcare, get free diapers, get free onesies, that are free from strings or free from kind of this like imposition of an ideology. And so my recommendation is always that the state should increase funding to real and legitimate services that people use, expand access to the services that we already provide through, you know, municipal, county, and state government. Do those things exist? Not necessarily right now, but that's part of what the advocacy should be for, is that there is a need. We should be fighting for those folks to get those things without strings attached to them. And people shouldn't have to jump through hoops to access childcare or get a, you know, diaper. Joel, go ahead.
Okay, thank you, Erin. And thank you for doing this tonight. My sister and brother-in-law, I believe, were your junior high teachers, Sally and Tony Sexton.
No way!
Yes.
Oh my gosh, I was literally in a group chat with my best friends, and we just sent a picture of Mr. Sexton yesterday. I need you to tell him hi for me. Please, please, please.
I certainly will.
Okay.
Sorry, everyone else, for that distraction. My question, and I'll try to form it as clear as I can. So it sounds like a lot of what gender justice is able to do is, you know, based on, you know, civil rights. So in places where human beings are connected by law or blood. And my question to you is, especially in light of the police violence and murder of Black people in Minneapolis in particular, Philandro and Dante and Floyd especially, that there are people left behind who are not connected through law or blood, that, you know, because of the trauma and the grief and the pressures of the trials, they're not able to work. I mean, it's a different kind of ableism, and because they're not connected through blood or through law, there's no social or economic safety net for them. So my question, I don't know if you can put together my question, is what efforts can gender justice do to help people that don't have laws, which I know are at risk as well, you know? So it's like, we want to protect the laws that are being attacked. And then, you know, in the States, yet we don't have economic, social, cultural laws in place. They've never been ratified, you know, those human rights by the Senate.
Yeah, no, that's a great question. I think I'll go back to something I said earlier, where it's like, we don't see liberation through law. Like, we're never gonna sue our way into liberation. We're never gonna like litigate our way into it. And so part and parcel of our legal work and our policy work and our narrative change, that coalition work means we sit at tables with groups who are doing, you know, UBI and universal health care and like paid family medical leave, to make sure that that social safety net is created and that the folks that we serve aren't left out. So a really good example would be, you know, right now there's a paid family medical leave coalition to create a state, you know, state-run paid leave program that follows you from job to job. So like, it doesn't matter how long you've been at this job. If you get hit by a car, you have a compound fracture in your leg, you can take paid time off to heal, right? Like, everybody should have that. Part of our contribution to that policy conversation is that the way that the laws are written is it doesn't acknowledge chosen family. So my boss, for example, she has a co-parent. Her co-parent they were never married, but they're the closest to each other. And so if, you know, they had their appendix out actually, and my boss cared for her co-parent while they got better. And the way that the current policy is written, there's no recognition of this person. They're not married, they've never been married. And so making sure that when we are sitting at a table, we're really thinking through, like, we're not trying to just get the best for most people. Like the people who are usually left out are usually the folks that we end up having to go back to court for, or the people that we usually end up hearing. And so part of our liberation work is working in that coalition space, is sitting at tables to decriminalize sex work and to make sure that we're, busting out the gender binary and all that stuff. So it's not the thrust of our work, but it is a core part of our work. And we know that that's a really important piece, because without it, what are we doing? Did that answer your question, Joel?
Very much so, thank you.
Yeah, not a problem. Actually, and I think maybe some of what I'm going to share might answer that even better. So I'm going to tell you a little bit about some of the cases we currently have. Here's our current docket. So we have Dovey, Minnesota. We're challenging the state's abortion restrictions under the state constitution. In Minnesota, the Minnesota Constitution provides broader protections for abortion rights than the United States Constitution. And so any laws that prevent somebody from having an abortion or deciding to have an abortion should be ruled unconstitutional. And we are representing Our Justice, which is an abortion fund, First Unitarian Society of Minneapolis, and an anonymous abortion provider and nurse midwife, so Dr. Doe and Mary Moe, as they sue the state. And that is ongoing. We should probably have trial coming up this summer. I talked about Thrifty White, Anderson v. Thrifty White, a woman who was denied emergency contraception at 2 pharmacists, citing religious beliefs. And we argue that that is, per se discrimination under the Minnesota Human Rights Act. We have Cooper, the USA Powerlifting, JC Cooper, our amazing client, who started an amazing trans rights lifting group as well. And we're fighting the junk science that is being used to deny trans people the right not only to compete, but to be great at what they do, because trans people get to be good at sports also. We have a few cases that are at the Minnesota Department of Human Rights. So when you see MDHR, our client is a trans woman who's incarcerated in a men's prison and is being denied gender affirming health care. And then we have Gutzman versus St. Benedict. This is also at the Minnesota Department of Human Rights. It's a MDHR charge. Our client experienced gender discrimination related to her track coach's commentary about her body and recovering from an eating disorder. And this is our gender discrimination and Title IX sports case. Last is we have Campbell v. Honor the Earth. This is a sexual harassment and retaliation case on behalf of a former employee of Honor the Earth. And I think we just finished discovery. This is one of our Time's Up Legal Defense Fund cases that we get money for to do that. Oh, and then we have this last one, Weiniger-Schultz versus the University of Minnesota. This was at the Minnesota Department of Human Rights. It is now a case. It's on behalf of a graduate student who faced sex discrimination in employment and education under the MHRA and Title IX. And then we have Mua v. Fairview. This is one of our clients who was denied the ability to pump breast milk while admitted to the hospital for postpartum depression support. And this is this is an old case, excuse me, Davidson v. Forte Steak and Seafood. There was a server who was fired for being pregnant, and the owner specifically said, "You are being fired because you are pregnant." And this is a client who is in North Dakota. I'm talk a little bit about our policy advocacy. So here's what we have on our legislative agenda. We are helping to usher through what we call the Patients' Right to Know Act. This is legislation that repeals the 24-hour waiting period for abortion and the state mandated counseling that doctors must provide that starts the waiting period. Chief authors are Representative Kelly Morrison in the House and Senator Lindsey Port in the Senate. We've been working on this for a number of years. It's the salary history ban. It bans the practice of basing salary for a new position on a candidate's past salary rather than their qualifications. And really how this shows up is, when somebody posts a job, they know how much roughly they'd like to pay for that job. But what's happened over the years is someone will say, "Oh, how much did you make at your last job?" And let's say they were planning to pay you $80,000 a year, but you made $60,000 at your last job. They'll be like, "Oh, we'll pay you $65,000. It's a raise for you, a huge savings for me." And this is a huge part of the gender wage gap and the racial wage gap, actually, because once once you have a biased wage, it just follows you from job to job. In states that have enacted the salary history ban, they've seen a reduction in both the racial wage gap and the gender wage gap. Like I said, we're on the Paid Family Medical Leave Coalition, which creates a statewide social insurance program to provide wage replacements for employees who need to take family leave or medical leave. And then we're part of the Communities Combating Hate Coalition. So this closes the loopholes that misclassifies hate crimes, and it allows victims to report hate crimes to non-law enforcement entities like community-based organizations like Gender Justice or the Minnesota Department of Human Rights. And then it also sets up funds to provide support for victims of hate crimes, because so often that trauma keeps you from being able to work, or you need services to keep your housing or to, mental health care. And that really needs to be a huge part of supporting victims of hate crimes. This was our team like a while ago. I know Dee's on the call. This is what we look like now. We're growing. When I started, we were really small. So that is a little bit about us, what we do, why we do it, and how we're doing it.
Fantastic. Thank you so much, Erin. That was so much information that I did not know.
I'm a wealth of information.
Well, and it's so, I guess, I don't know if exciting is the right word, but it's so good to see like how many cases you guys are involved in and what's on the horizon.
And we only have 2 lawyers, y'all.
Wow, that seems amazing, actually. I'm going to invite people to ask questions if you'd like, if anyone wants to speak up like Joel did, or if anyone wants to put their questions in the chat, they can do so. While people are doing that, I'll get started on asking some questions that people put in their registration forms. So we had a lot of questions, everyone, so we are going to get to as many as we can. But the first one is, so we've seen a lot of different things across the country, really against gender justice and laws that are going into place in other states. So someone was wondering, what are you concerned about being introduced here in Minnesota in the near future?
My biggest concerns. We are seeing, so there is a coordinated attack on trans people in this country. It is a legal messaging and litigation campaign essentially meant to erase trans and ultimately LGBT, but like really this is centered around trans people, particularly trans women, out of existence. And, we have bills around the country that, yes, ban trans youth from sports, which is just like a particular kind of cruel, but bans gender affirming care or provides felony penalties for providing gender affirming care, or would report a parent for supporting their child and getting gender affirming care. We've seen bills introduced that criminalize teachers who talk about LGBTQ people, like Don't Say Gay bills in Florida. And, of course, the bills against teaching about racism, systemic racism. This is all, coordinated by like right-wing billionaires to privatize public education. Like, I want to be very clear. Yes, there is an agenda that lives underneath that, which is to institute like a white, cisgender, Christian, heteronormative culture and instill that into children through schools. And part of it is also in response to the deep work that people started doing after the murder of George Floyd, when they were like, I really have to do more. And some of that included changing the way that we talk about our history and talk about our systems. But ultimately, like the top goal there is really just to pave the way for the privatization of our public education system. So I'm just watching all that happen in the background, watching it happen through trans and LGBT people and our histories. So I'm concerned about that. We've already had an abortion ban introduced in the state of Minnesota in the legislative session, so that happened. But I'll be honest when I say that, like, there are new and terrifying ways that opponents of gender equity find every day to introduce bills that shock me. So I'll give you a good example. Representative Eric Lucero introduced a bill last year that not only banned trans students from participating in sports, but it would charge them with a petty misdemeanor for doing so. Like criminalizing children for playing sports. That was a new low that I was like, how do you hate a group of people so much that you like think of that, right? So sometimes I find my lack of imagination, like how can you be horrible, to be a downside, because I can't anticipate some of the worst stuff. So I try to just prepare myself, and then do that proactive work to share why it's important to be inclusive, why it's important to stand up for students, right? So that's kind of what I'm anticipating this session, although new things happen every day. And next week, my answer might be a little bit different, but that's what I'm preparing for.
Thank you for
Sorry,
sharing.
that wasn't hopeful.
Don't worry, we'll ask you what you're hopeful about later. We'll try to end on an optimistic note, but the next question, so as I said, if anyone wants to speak up and ask their question, feel free to do so, but if people are not putting questions in the chat, I'll just keep going down our list. And so that we got a few questions about how to address people who are clear roadblocks or barriers to change, both like just in the political sphere, and then also in terms of like how to approach management at an organization when it comes to advancing these things and advocating for gender justice.
So, I mean, politically or like legislatively, that might get into more of like the C3 answer. Remember I talked about like the C3 is vote for people who align with your values. I don't work on the C4 side, and so my answer might be a little bit high level, but it's that like every seat in our legislature belongs to the community that voted for that person. And so if that person does not align with your values, find different butts for the seats, whatever that means, or talk to the people who are in office. I will be honest and tell you that personal stories do change hearts and minds. And more often than not, one story is actually better than a lot of stories. And so we have seen in like a number of states, and was it Arkansas, the governor of Arkansas, he vetoed a ban on trans athletes participating in sports because of like one story he heard. And I think something similar happened in like Utah or Idaho. It really is possible to change hearts and minds with stories. In terms of like at organizations, I think one of the hardest, like when sometimes we know the right thing, but we can't articulate it, it's harder to tell someone how they're doing something wrong or why it might be harmful and how they need to change. So some of the work to remove roadblocks is getting really clear on what's the roadblock or why is it the roadblock? How is it harming people and what needs to be different? Because sometimes too, you can tell somebody like this thing is not helping. This is harming people. And then you don't have a suggestion on how to make it different. Well, then what do you do? Because now you can't do anything. You can't do the thing you know are harming people, but you still don't know the thing that wouldn't harm and repair that harm. So a lot of our own work is to get clear on how we articulate that and how we are part of solutions. I know that was very high level, but that would be my answer. I
think that's a very helpful answer. Another question that we have in here is how, kind of a question getting at intersectionality. This person was asking how disability impacts gender justice.
Well, I mean, there's like the high level answer and then there's like the nitty gritty, right? So we have the sub minimum wage in the state of Minnesota, which allows companies to pay people with disabilities like way less money than what our minimum wage is. I can't believe that's legal. I can't believe somebody hasn't sued to stop that yet. And women are disproportionately disabled. And so you have a whole bunch of disabled women and femmes in the state who are making the sub minimum wage, who aren't able to, accrue wealth or be independent, or if they get married, they make too much money and then they lose some of their social services. But the way that gender oppression works, right, is that anytime you add layers on top of it, it's compounded, right? So you add race, you add disability status, you add immigration status, you add gender presentation. not just gender identity, but gender presentation. And you sit at the intersection, right, intersectionality of all of those compounding isms, and it affects it more and more and more. And so when you think about, we talk about the gender wage gap, we generally are combining like all different types of women and femmes together. If you disaggregate that out for trans women, Black women, trans Black women who are disabled, right? Like you get all of those things and you start seeing kind of the strata of how discrimination and bias work in our society. So disability affects gender justice in the same way that any marginalized identity contributes. Does that make sense? Not any, but in the way that we know being disabled already limits your ability to participate in this world and in this country and in this state.
The next one that we have on here is what advice you would give to a young professional wanting to follow and do this type of advocacy work, and where they should start and get experience?
That is a good question. So I'm going to start by saying, find something that you're passionate about. Advocacy work can burn you out. I do a lot of therapy and follow the advice of my therapist, because why would I pay money to not do what she tells me to do, in order to be able to bring my full authentic self to this work. Because I think we have to make advocacy work irresistible in order to sustain our movements, right? There has to be joy in what we do and with each other. There has to be like a vision that we're working towards. I often think about, my ancestors as a Black woman, like there were people who were there at the beginning of slavery and there were people who were there at the end, but there were way more people who were there in the middle that didn't see the beginning and they didn't see the end, but they still did the work. And I don't know where I'm at in that journey. I assume that I'm always in the middle, that I didn't see the beginning and I won't see the end, but that my work is a crucial piece of liberation. And so because of that, I have to be really passionate about this, because that's what sustains me and fuels me on days where I'm like, I can't even, right? And so first find the thing that you're passionate about. And it doesn't have to be your work. It doesn't have to be your job. You can be an accountant at a Fortune 500 company and still be part of the work. You can be an artist who paints exclusively murals on nurseries and still be part of the work. So find the thing that you're passionate about, and then find the part that you can contribute that works for you. The second is, once you figure out what that is, then you have to find time outside of that. Like I'm going to tell you right now, I need everybody to have like 1 to 2 hobbies that have nothing to do with liberation work. I need you to have friends that aren't part of it all the time. I need you to do things that aren't part of it all the time. And I need you to know that it's not all on you. Like if it was all on one person, it wouldn't be a movement and it wouldn't be successful. And so whether that's like taking the time, if you're in school right now, to just like learn all that you can to find out where you might want to fit in, that's enough. Or if it's like volunteering at a bunch of different places to be like, I actually don't know what I'm passionate about or what I'm good at yet, so I'm just going to try a whole bunch of things. That's okay too. Internships are great. But like one of the most frustrating parts about being in school, no matter how old you are, is that you're still learning how to do the thing you want to do. And so being okay with like starting the thing that you want to do and knowing that it's not going to feel like the problem solving, like amazing superhero that you want to be right away. It'll never feel like that, to be honest with you, but certainly at the beginning, it probably won't. And just know that every piece is important. If it wasn't, it wouldn't need doing. Does that help?
I think that's super helpful. I'm definitely going to take with it like the nuggets about finding the joy in the work, and then also that if it's just you, then it wouldn't be a movement. So like really having those supports around is so important into keeping like sustaining things. It looks like Joel put another question in the chat. Do you want to ask that question, Joel, or would you rather I just read it?
You can read it, or you can read Tyler's above mine, which is pretty similar.
Okay. I think you just answered a question. I was typing. I was wondering if you thought this was a coordinated effort among a group, a political party, or religious order, a mishmash of efforts. Yeah, yes, it is a coordinated effort, and it crosses political, religious, And then often it, is centered around like extremely wealthy people, right? Who fund the religion, who fund the political, who fund the think tank. And I'm going to give you a really good example that is actually lives outside. Well, it lives outside if we're talking about like LGBTQ rights today. The anti-abortion movement was not created in response to Roe v. Wade. It was not created by religions that were like, we have a moral opposition to abortion. It was created by a Republican Party operative who was looking for a way to coalesce the white evangelical voters in the South who opposed the integration of schools. And he thought it was too racist to say, like, how do we get the segregationists together? So he looked for all of these different issues and found that abortion was the most unifying issue for all of these voters. And that is how that is like how the anti-abortion movement as we know it today started. It wasn't like, some of the first abortion rights laws were signed into law by Ronald Reagan and Republicans in California and Texas. The Southern Baptist Conference has, memorandums and resolutions from the 70s being like, we totally affirm people's right to decide if they're going to have an abortion. So it was like created and then like given to, right? And as power was derived from this voting block, more people who wanted that power would speak to that voting block. Okay, so today, I think I talked a little bit about this. In the history of gay oppression, violence, the coordinated attack is to do a few things. One, the increase in support for LGBTQ rights diminishes the demonization of LGBTQ people and its power, right? And so some of it is to take that power back by specifically focusing on the trans community, because most people are not transgender. A lot of people don't know a transgender person, and it is harder for them to understand like a difference in their gender identity than it is to understand like just everybody loves somebody. I guess I can understand if you love somebody of the same sex or gender, right? And so you add in like nobody knows about their body or biology or about how like gender works. It's easier to peel people off and then to play to fear of who's being harmed, cis women. And so that, yes, is about trans people, but it is mostly about reducing support for LGBTQ broadly, painting us as dangerous people who are threats to cisgender straight people, who are threats to societal order, who are threats to our children. So you're seeing now in some states, I don't know if anybody heard about this, but they're bringing up this like furry thing, that there's litter boxes in schools now for people who identify as furries to use as the bathroom. That is also deeply rooted in anti-LGBTQ rhetoric. It's really just to create the enemy and then use that as a way to erode rights, because ultimately what this is about corporations being able to deny people wages, employment, and to like push people out of society, right? I can discriminate against you for being gay. I can discriminate against you for being Jewish. I can discriminate against you for being a woman. I can discriminate against you for being pregnant, Black. Like they want all of these exemptions to rights, civil rights, human rights laws, so that they don't have to comply with them, because capitalism, you need to make, if you can, oppress people, you can make more money. So ultimately, it is about creating that social hierarchy where you can control people and, use them to make more money. It is ultimately all about that. I know I went like level, but that's really what it's about. And it starts with the most marginalized. And so we're seeing those attacks on trans people, on race equity, on women and femmes. I hope that made sense.
Yeah, I think it definitely answered the question. And I think we've been talking a lot about advancing policies in the government, but we did have some questions also about what we can be doing at the university level to advance inclusive policies. And I wonder if you have any ideas about that.
So I'm gonna, full disclosure, I didn't go to the U, and so some of my best ideas are about different levers to pull. I don't know all the levers to pull at the U. However, organizing is always a good idea. So I think student advocacy is hugely important. And I think student advocacy at your school is hugely important. So like things I think about are, there are CPCs in and around the University of Minnesota. If I was a student there, I would be like blanketing the campus with information about like, don't go to this place if you want to get reproductive health care, or making sure you have a trans inclusive policy for athletics and for, pretty much everything. I don't know where all the policies live. Showing up at, like, people are less likely to do things when there are eyes on them. Like, show up to your regents meetings, show up to those meetings where people are making these decisions, like finding out where in the bureaucracy decisions are made and being there and lending your voice there, finding out how to elect student representatives to that. So I was one of 2 students who was elected to the Board of Trustees. I went to the University of St. Thomas. And I promise you, the Board of Trustees was so upset that I was the one of 2, because I was like a known rabble rouser on campus, but I organized people to elect me to do that so I could go rabble rouse at the Board of Trustees. Find out where your eyes can be best. And sometimes it's like the least sexy sounding positions you can think of, but we always need folks who are committed to liberation in those places. I'm just going to leave it at that. I think that's enough. I think that's more than enough. Find those levers.
Yeah, and I think that's an excellent answer to leave students with. So I wanted to go on to that last question that I teased earlier about asking what makes you hopeful for the future of gender equity.
Oh, okay. I know I talked a lot about like the backlash and the bad things that are happening. That is evidence that we're advancing. Like, I don't know how to tell you how hopeful I am, not just for the future, but for this moment, because more people than not are ready. They're like, this is evidence of the change that's happening. It's not like going to happen and like maybe happen, like it's already happening. And so some days when like it's a shitstorm, I'm like, yeah, it's working. Yeah, we're winning. So sometimes I just look at the deluge as evidence of how powerful we are. And we really are. So I am incredibly hopeful. Sometimes I just try to look at the bad stuff as evidence of all the good that's happening. I mean, there are almost 40 people on this call tonight. Like, that's huge. We're like 3 years into a pandemic and we're like zoomed out at 7:05 and almost 40 people showed up to this. Like, these are the moments that I have the most hope, is that there are pockets like this all across the state. Like, literally, I did a presentation similar to this for the public library system, like way up north in Minnesota, that had a bunch, like, it's happening everywhere. And so I am just incredibly hopeful that we are organizing in the right places with the right folks and like doing our part in our lanes, because you can't have a backlash to a thing that doesn't exist. So I'm very, very hopeful about our present and our future. Enough that I'm even having a baby. It's like, can you be more hopeful? You're going to bring a child in this world. So that's what gives me hope.
Thank you so much. Oh, sorry, Laurel, go ahead.
I just wanted to point out that Finn, who's the interim director of the Gender and Sexuality Center, pointed might be compelling is the Transgender Advocacy and Action Team. So that's a hopeful point there. So and Finn included a link to what that group does in the chat. So yeah, so I would also offer the opportunity for our co-sponsors, the Gender and Sexuality Center and the Women's Center, to share anything that they would want to share before we're done with our call tonight. But yes, my other thought for Erin is like, how do you think U of M students or staff can make a difference in supporting you at gender justice or in your work?
A few different ways. So one, I really encourage you to, our email list, we always send out updates for people to like add their voice. We never send out an alert if we don't need you to do something. So every time we say, please do this thing, we really need you to do this thing, whether that's writing written testimony, sending a form letter to your legislator, especially for those of you, I mean, I'm assuming a lot of you live in the cities, but especially for those of you, like I grew up in Apple Valley, I live again in Apple Valley, but I stay registered to vote in Apple Valley. My legislators were Apple Valley legislators. So whenever I emailed about a specific thing, I was sending them to my Apple Valley legislators because that's where I grew up. Sharing our information. So a lot of this narrative change work that we do requires people to see it and read it. So it's one of the few times where sharing on social media is doing something. Donating, although I don't know if students are the best group of people to hit up for money, but donating is always important. And then, sharing, like you can share your story with gender justice, especially if it fits into like any of the categories we do our work in, because we do, I'm putting my email into chat, we do need personal stories sometimes. Maybe that isn't to like share it publicly, but just to like send in a one-on-one letter or to testify in a committee virtually. And we're having a lobby day on either March 25th or April 1st for Unrestrict, and I would love for everybody to be there. It's all virtual, so you can just sit right where you're sitting right now and still participate in the full fun day.
That's great. And we will be sending out a follow-up email after this, and we will definitely include the information about the lobby day and all those other ways to get involved that you mentioned. I also saw that Anitra put in the chat the Women's Center newsletter, which is another good way to get involved on campus. I'd like to encourage everybody to visit the links for GSC, the Women's Center, and then the Center for Community Engaged Learning for information on advocacy on campus, especially our Ways to Social Change page. We put a bunch of resources on there. Of course, the Gender Justice website has a bunch of information as well. Erin kindly put her email in the chat. So you can reach out to her if you have questions. I have a feeling you might be getting some questions because there were a few people who put in the Q&A about how to work with gender justice. So I hope those people reach out to you. And thank you for everyone for your questions and for your interest tonight. We really appreciate it. If you're in CESP and plan to use this event for your collaboration and community building reflection, look for an email from me tomorrow. And if anybody has any last questions or comments, please let us know. Otherwise, thank you all so much for attending, and thank you so much, Erin.
Thanks so much for having me. Have a good night, everyone.